Hello everyone, my name is Ruth Namubiru and I serve with the Remnant Generation as the Health Program Officer. I help to oversee health activities that are implemented here in Kampala and the Antonde, where TRG serves teen mothers and survivors of sexual abuse. Let me interest you about the Antonde. It's one of those regions where healthcare provision is very minimal. They barely have pediatric facilities, which are key to teen mothers and their babies, and the babies born to teen mothers. So we have been challenged in this very region with the fact that transportation is very hard. The region has only one ambulance that can enable you to rush a baby in emergency situation to a nearby pediatric health facility, which is actually 2 hours drive away from where our teen mothers deliver from at our partner hospital in this very region. So just last year, we had 11 babies, may their souls rest in peace, that we lost because of these avoidable circumstances. 9 of these were coming from this very region. Because of, there is no available oxygen on time, they need to be rushed to be reviewed by the pediatricians, but then these health centers are not are not having the capacity to handle, and then we need to rush these babies to that 2-hour drive facility to be able to get the emergency pediatric care. So we realized that once we avail an ambulance at this facility with our partner hospital in this area, one, it is going to be able to serve our beneficiaries on time because of the transport delays, which is one of the major contributions to maternal mortality and child mortality rates in Uganda. So we will be able to address that. But then not only that, but then to be able to reduce or eliminate the infant deaths, the newborn deaths that we have been having due to inability to provide that emergency pediatric health care. So with the availability of the ambulance, we are able to rush them on time to that partner hospital we got in Barara, which is the only pediatric center in the entire region. It is serving about 4 districts in that very entire western region of Uganda. So we are able to have our babies rushed there and on time and reduce on these infant deaths in our country. So together, you and I, we can make a difference and increase the chances of survival for babies born to teen mothers. Just recently, we received a case of a 17-year-old. She was pregnant with twins that we rescued from one of our safe motherhood engagements, our community healthcare outreach program that we run in this very region. And we were able to walk the journey of clean and safe delivery with her at a professional hospital and attended to by professional health workers. And she was discharged days after. Just 5 days after discharge, while in this very community, we received a call that the twins were not well. They were not breathing well. They had refused to breastfeed, and all of a sudden they had these fevers. So the teen mother was so scared and frightened. On rushing these babies to the nearby medical clinic, their oxygen levels were dropping. We called and tried to reach out for an ambulance in this region, and it was not available. It had responded to an accident emergency, and we could not be able to access it. So we had to find a way to get a car, one of these special car hires that you can find on the road parked, and then we had to rush to meet this girl in one of the remote areas of this region. We didn't have anything, just had to borrow an oxygen cylinder to make sure that we have oxygen supply with us to support them as we transported them to a 2 hours journey to the only pediatric center which could address them. In the nearby district, it's a 2 hours drive to get there. So on reaching there, the babies were attended to, they received the emergency first aid care that was needed, but then suddenly we lost one of the babies. The other survived, but also developed what we call a chronic lung disease. So it is necessary for her to be referred to Kampala to see more specialists to address this situation. Just getting an ambulance from there to take her to Kampala, it is costing about $270. That is close to 1 million Ugandan shilling. So it is very expensive to, first of all, hire an ambulance. You have to pay the driver, you need to fuel it, and then pay that maintenance cost. And then also availability of that ambulance is also, questioned. It is not always available. So together, once we avail an ambulance for this region, and then we station it at our partner hospital, first of all, it will be addressing the needs of our beneficiaries and the babies born to our beneficiaries. Those are the teen mothers. And then also, we are able to give timely healthcare support, which will contribute to excellent and improved healthcare outcomes. Together, we can change this story.